Welcome to the Sparked Standards in Action Showcase, where active Sparked community implementers share their perspectives, experiences, and example implementations of some of the FIRE implementation guides designed by the Sparked community. Here we will have community representatives showing the art of what's possible using the community design specifications to enable safer, more connected, and more efficient healthcare. I'm your host, Michael Hosking, Deputy Lead for Community and Engagement for Sparked. For this showcase, we'll jump straight into the discussion. For a background on Sparked, what it is, our goals, and related resources, please visit sparked.csiro.au. Today, we're joined by Paris Mojo and Federica Lanzo from Orion Health. Paris is a former critical care nurse turned digital health leader, now driving national transformation projects at Orion Health. She's known for bridging the clinical insight with digital strategy to deliver technology that works for healthcare. Federica is a digital health strategist with a background in biomedical engineering and precision medicine. She leads Orion Health's work on HL7, Sparked, and International Patient Summary, bridging global standards with real-world care. Thanks both for joining us and for sharing your experiences, and also a demo which we're excited to see.
Thanks, Mike.
Thank you so much for having us, Mike.
Okay, Paris, from your organisation's perspective, what's the current challenges that you've faced sharing health information in Australia?
So as you mentioned, before I moved into digital health, I was a nurse, and I can't tell you how many times I charted the same thing on paper in 3 different places, and still had no idea if anyone read it or if there was, information updated that I could access in an easier way. So what I know now is that this is still the reality in so many places. And even when there are digital systems, we still have patchy clinical records, clunky portals, and patients that are asked to repeat their stories over and over again. So like an example is Justice Health New South Wales. The clinicians who look after inmates who often have quite complex medical history, they were flying completely blind before they integrated with HealthyNet. So HealthyNet is a statewide clinical portal that shares sort of summary level patient and clinical information all across New South Wales Health Services. So that's where clinicians can just log in and have access to, patient information and also my health record information. So now clinicians at Justice Health can just log in once and they have access to that longitudinal patient data. It's not just convenient, it's also safer, and it's informing the care decisions that they make. I guess getting to where we are today also often means custom APIs and manual mapping and hoping that things are not going to break during the next upgrade. And that's what we're trying to move away from.
Absolutely. Yeah, that's a good summary. I think there's a lot of legacy stuff that's floating around, which makes it hard to connect properly and meaningfully. And what problem does Spark solve?
Yeah, so, you probably know Orion Health as, we sell products, but we're not just a product company. From my experience in the last 3 years, we're also we're a delivery partner. So we help, jurisdictions and healthcare organizations. We bring those complex programs of work together. And that means that we have to integrate systems that we're not always designed to talk to each other, like hospital EMRs and pathology and diagnostic imaging, national infrastructure like the My Health record. And always the same purpose is we need to make sure that the right data gets to the right person at the right time in the right format. And I guess that's where Spark comes in, right? It's what we've all been crying out for. It's just a shared, I don't want to say like a shared playbook. So, we look at those standardization and we say, yeah, it will save time, it'll save budget. But what it does, in my view anyway, is the final outcome is that it builds trust between the vendors, the health services, and the people who use the tech. And those are not just the clinicians, but they're also the consumers, right? So When we go to Spark and learn from what you're doing and start adopting what you're doing, we can scale across entire regions and jurisdictions without having to reinvent the wheel every time.
Yeah.
So at a high level, I think that's what we do, but maybe Fedi has a bit more of a...
Yeah, you touch on a very, very good point, Paris. I think Spark is this community where all of the voices come together. It is consensus driven. So the technocrats, the super tech guy of the specification come together with the vendors, with the patient voices, with the clinicians, the health professionals from different side or different settings, age care, allied care. And it gives you participating to such a community, gives you very wide perspective of what goes on, and you're not just focused on what you have to do, what you have done all of this time. So for us, really having access to this variety of expertise is such an invaluable piece, really, to help us grow, to develop strategically. So not just thinking about our little niche, but looking at the future and looking at a variety of use cases, which were not presented to us to start with. So really great opportunity to hear voices from all around the sector, learning, access to experts, and even feeling like you can contribute because you're one of those voices. So from our perspective, being heard as a vendor, what can actually be implemented? What is the real deal? Because you can think of standard, but if the systems are dealing with data in a specific way, well, you cannot expect them to get to the final destination, to the final goal in a matter of years. So there is that sensible approach to growth and evolution, which I really appreciate.
And it seems like Orion's getting a lot of value of contributing and participating in that from a product development cycle. And I guess to elaborate a little bit more on what Spark standards you're actually implementing, I'm keen to know a little bit more, Fed.
Oh, yeah. So we have been part of Spark since the very beginning, and we're quite proud of it, and we have learned a big deal. As you know, Mike, we are an international company, so we need to adopt to a variety of standards. Why we decide to join Spark, and it's even to have, of course, a good lens on Australia, but at the same time, it's a program that is driving evolution with great momentum. And so we decided to adopt specifically AU Core, well, the resources that we're familiar with AU Core profile, which help us really get into the nitty-gritty of what is possible and how things can change nationally, and how then we can apply those learnings internationally. So as you might know, we deal with AU Core, but as well as US Core. We're looking at the European use cases. Then there is UK Core, which is forming, stabilizing, is a bit too green. We started with that one, but we didn't see much traction as much as there is in Australia. So AU Core is one of those implementation that we look at very carefully. And the other one is the AU patient summary. As you know, one of our big solution, or one of our foundation for Orion Health, is delivering HIEs, this health information exchange, and we think we can be that solution that provides at the top level the IPS, the International Patient Summary. International Patient Summary originally was designed just for emergency and unplanned care, but we have learned through Spark that there are actually a variety of use cases that the different parts of the sectors of the industry are interested in developing. And so it's thanks to Spark, the programs attending to TDGs, CDGs, and connectathons, that we learned that we need to provide some sort of flexibility to our IPS. And that's a lot thanks to the AUPS.
It's great. It's good to hear that there's lots of opportunities and use cases that those standards can apply to. And I guess I'd love to see that in action and what those standards look like in terms of how you've embedded those into your product. So a demo would be fantastic.
Yeah, so we'll be very happy to show you how we use the AU core profiles and the AU patient summary profile on top of our HIE, and doing that by our FHIR framework and by integrating with a variety of different sources, something that we have already actually tested at one of the last Connectathon that was in Sydney. My team had the pleasure to come and really demonstrate how we could integrate with the AU Core FHIR server, some national repositories, some of our own Orion Health data storage, and produce a document that matches the AU patient summary.
Oh,
So,
fantastic. Well, let's have a look.
Welcome to the Orion Health demonstration of our International Patient Summary, or IPS. Over the past decade, we have worked to iteratively refine our implementation of the FHIR framework. Today, we're excited to show how that work comes together in the generation of an IPS. This has been a journey of development and collaboration, including one of our key partners, Sparked. Through Sparked, we connected directly with clinical and technical experts, tested real-life scenarios. This helped inform and shape the way we've approached implementing the IPS. Through the Accelerator program, we gained valuable insights and refined how we deliver IPS interoperability. This past March, we participated in the HL7 Australia Connectathon, where we integrated with the National FHIR Server and third-party practice management systems, providing valuable insight and validation of our approach. It highlighted new testing methods and gave us the opportunity to reconsider our assumptions based on new perspectives. So let's dive into the demo. We'll begin with the technical overview. Now, our IPS is structured in a JSON format and based on the IPS universal profile. We have implemented the 3 required sections: allergy intolerance, condition, and medication history, and 1 additional recommended section, diagnostic report. Here you can see that I've set up Postman to point at our IPS REST endpoint, and this is pointing to one of our demo systems. Applications would invoke this with a patient identifier to request an IPS document for that patient. As you can see, these are the parameters. And when I click send, what I've done is I've invoked the request and it's been received by our IPS generator. In the background, it's coordinating FHIR requests for allergy intolerance, condition, and for medication history, it uses medication request, administration, dispense, and statement. And for our last section, diagnostic report. Now the response is quite large for this patient, but if we scroll here, we can see that it's a JSON document conforming to the IPS specifications. Now, requesting systems may choose to use the discrete data elements in each section. For example, here in the allergies, if we just quickly search, you can see discrete data elements, or they may choose to use our narrative sections, which are formatted as HTML snippets. Now, of course, this JSON document is the behind-the-scenes application level exchange and interoperability. We still need a way to present this information to clinicians and patients alike. So now we move to the Orion Health Clinical Portal. Here we see Caitlin Connor, who is a clinician, reviewing a patient record for Gerard. She can see his clinical data in the standard summary view: allergies, conditions, medications, diagnostic reports. However, as soon as she needs an IPS, she would go to the tree on the left and select it. When she clicks on this IPS document link, the service endpoint, which we saw earlier in Postman, is called, and the patient IPS is generated on demand using up-to-the-minute patient data. Now, in this demo, we've used the individual narrative HTML sections and combined them into an HTML page. This gives us flexibility in formatting and display, for example, branding. Systems using our IPS on-demand endpoint may choose to use the native displays within our application, leveraging those discrete JSON data elements I demonstrated earlier. Now, this presentation of IPS within our solution is not intended to be limited to only Orion internally generated IPS, but also externally generated IPS that the solution may have access to. In this manner, solutions can get a running start to interoperability, which in turn improves accessibility to key data for clinicians. We believe that this technical framework and visual representation of our IPS lays the foundation for future care that is accessible, secure, cross-border care, allowing health data to follow the patient wherever they go. At Orion Health, we're excited to help build that future, a future where connected care is the standard, not the exception. Thank you.
Thanks for sharing such an interesting demo. It's really exciting to see the potential and application of these standards in action. And I guess this bodes nicely for the future of connected care. So, Paris, why should others get involved in Sparked?
Well, why are we part of Sparked? And I guess personally, I just love the sense of community and belonging. Is it a cult? No, I don't know. It's just a really nice community. Just a lot of fun, and you get to see, people coming from all different parts of the sector, which is just great. And now that you've shown us what good looks like, we keep coming back because we want to make that the baseline, not the exception. So, being part of Spark, it means for us that we're not just building for one customer at a time and then have to reinvent the wheel. We're tackling the deep core issue of siloed information and fragmentation. We know when we listen to clinicians, they tell us they are drowning in disconnected systems. They are data foraging, which I love that term because as a nurse, that's what you do. You go foraging for information. And patients constantly repeating their stories over and over again. And the IT teams, they are so stretched and they just try to just patch it and duct tape it all together. So with the help of Spark and as Fedi so eloquently put it, it helps us work behind the scenes so that we can make the integration more robust and without disrupting clinical workflow. So we bring together, and that's part of my job every day, is I bring together people and processes, and we try to turn pilots into sort of nationwide solutions. So every time that I've attended, I've taken something back. And I feel now that as a nation in Australia, we have that reference point, and we're not constantly debating and renegotiating the specs or reinventing the wheel. We've got that baseline that we can test against and build from, so that delivery is faster. There's not so much rework, and I guess circling back to my previous point, it builds that trust between everyone involved.
Yeah.
Absolutely.
So, yeah, be part. Come and be a part of Spark.
Yeah, trust, connection, and interoperability and repetition. You do it once, you repeat it all over again, right? As many times, saving times and costs, not just for organization, but for people. So patients and health professionals.
Absolutely. And I think one of the exciting things for me is seeing all of these different software providers working together as a community to lift that benchmark up. So I feel like that's really humbling.
Yeah, I agree.
All right. And I guess final parting question to you, Fed. What's one key insight you'd leave with in terms of adopting national fire standards?
So I think that when you try to align to a national standard, so in this case, the EU Australian for us was AU Core and AU Patient Summary, you really get to a testing ground, and that's why connectathons are so great. As you just mentioned before, it's a very open environment. All the vendors play nicely together, which is where everybody and everyone should go. The data is patient data. It's not vendors' data, so just let it flow. Like they indicate in the 21st Century Cures Act, if you don't do that, you could be claimed, you could be blamed for information blocking. So really coming together, testing out that things actually work on a specific workflow, on a specific use case. Because in the case of international patient summary, yes, we see that it should be at a very international global level. It's very high, very abstract, but we're going to reuse this over and over again through national standards with specification, with specialization that we need to be able to handle. And really, when you get to adopting a national standard, that's where the rubber hit the curb. Is that the right expression? Yep, more or less.
Rubber hits the road, yeah.
Hit the road, not the curb. I'm Italian. I try. But that's really when you realize if what you built, which should be as generic as possible, as flexible as possible, really meet the concrete elements, the real workflow that needs to work. Yeah.
Absolutely. And I think, yeah, you're right. With those connectathons, it's fantastic to see people bringing their products and testing it against the standard and testing the standard against those products. I think that's a really good way to iteratively improve over time. And like we mentioned, lifting that benchmark up higher for everybody, and that benefits everybody as well.
If I may add, some of our team members actually went to another connectathon in Europe, which was the HL7 International in Madrid, and I know some of the SPAC members were there as well. We provided our team there with patient summaries that were produced by of course, by ourselves, but learning through Spark. And those samples were used to contribute the validation of the European patient summary. So it is all going full circle. And we felt so happy and proud to have contributed to the European health patient summary. But that's even thanks to the learnings that we gained through Spark.
That's fantastic to hear that there's a global lesson improvement cycle happening. That's really good to hear.
Yeah.
So thank you so much for your time, and I really appreciate the investment that you've contributed to these national fire standards, and we can't do this without you. And for those watching at home, if you're interested in participating in Sparked, we've included a QR code that will take you directly through to registering. And also, please feel free to jump onto our website to explore and have a poke around. We also have a Sparked Podcasts, season 1 for those that are interested. And we've got season 2 that's coming out soon too. And we share a lot of information and updates on LinkedIn as well. And lastly, if you do have any questions, you can email us at sparked@csiro.au. Thanks very much, Paris and Fed.
Thank you so much.